Community Health Worker Training, Cardiovascular Health and Diabetes, Module 3B, Heart Failure Prevention. Learning outcome for this mini module is to describe strategies for preventing heart failure. Many of these strategies are also important for people who are being treated for heart failure to follow after they've been diagnosed with it. Preventing heart failure. Even people at high risk can significantly cut their risk of heart failure through healthy lifestyle choices, such as managing comorbidities. So morbidities like diabetes or high blood pressure can contribute to heart failure. If the person gets these chronic illnesses under control, it significantly decreases their risk of heart failure. Eating a healthy diet. Eat plenty of high-fiber fresh fruits and vegetables and whole grains. Choose fish as a protein source and reduce full-fat dairy and red meat in your diet, foods that are high in saturated fat. Cut back on salt, especially in processed food. Get to a healthy weight. Being obese is linked to higher LDL, bad cholesterol, and triglyceride levels, and to lower HDL, good cholesterol levels. It's also linked to high blood pressure and diabetes. Being obese or even just overweight can increase heart disease risk. Eating healthier and eating less calories, even healthy calories, will help you shed excess pounds. Exercise. Not exercising is linked to heart disease and can also impact a variety of general health risks, all of which in turn raise heart disease risk. Obesity, high blood pressure, high triglycerides, low HDL cholesterol, and diabetes. Getting regular physical activity can lower all of these risk factors. Stop smoking. Tobacco can have a serious effect on your heart as it does on your lungs, raising the risk of both heart disease and heart attack. Drink less. Too much alcohol harms your heart in many ways. It raises blood pressure and triglycerides, a contributing factor in atherosclerosis. The recommendation is for women to have no more than 1 alcoholic drink a day and men to have no more than 2. And red wine is the healthiest selection in terms of alcohol because it actually helps heart health. And finally, reduce stress. Stress can increase your risk of heart attack and stroke. Now we're going to delve in a little more detail into some of those recommendations, starting with a low sodium diet. High sodium intake is a major problem in the U.S. On average, American adults eat more than twice as much sodium as is recommended. The Dietary Guidelines for Americans recommends that Americans age 2 and up reduce sodium intake to no more than 2,300 milligrams per day, about 1 teaspoon from all food. Certain people should have even lower sodium totals, including people who are over 50, people who are African American, people with high blood pressure, diabetes, or chronic kidney disease. Those people in those higher risk categories should eat no more than 1,500 milligrams a day, which is about a half a teaspoon from all food. Too much sodium in the diet is bad for your health. It can increase the blood pressure and increase risk for heart attack and stroke. And limiting sodium intake is one of the most important things people can do if they have heart failure. The reason it's an issue with heart failure is that sodium can cause the body to hold on to fluids. Too much fluid in the body adds weight and makes the heart work harder. Also, too much sodium can cause swelling and shortness of breath and cause weight gain from extra fluid. And if it's severe, people with heart failure may need to go to the hospital. A low sodium diet can help people feel better and allow their heart medicine to work better. People can change what they eat and how they cook. Start slowly and work up to bigger changes. Take a moment now and watch this video about some guidelines for how to start to eat less sodium.
How to reduce your salt intake. Limiting your daily salt intake can help prevent major diseases. Here's how to cut back. You will need low or no sodium packaged food, herbs, vinegar, and lemons. Step 1. Read labels when you shop. If salt or sodium chloride is one of the first ingredients listed on the label, don't buy the product. Step 2. Avoid high-sodium foods such as chips, salted nuts, and dressings. If you must eat them, try the low-sodium versions. Step 3. Buy fresh or plain frozen vegetables. Most processed foods have salt added for taste and as a preservative. When buying canned vegetables, look for ones labeled no salt added. Processed foods account for most of the sodium and salt we consume. Step 4. Rinse any canned foods that do contain sodium under running water to get rid of excess salt. Step 5. Flavor foods with herbs, vinegar, and lemon instead of bouillon cubes and sauces, which are high in sodium. Step 6. Don't put additional salt on your food. Remove the salt shaker from the dinner table. Kosher salt, sea salt, garlic salt, onion salt, and many prepared spices have no less sodium than table salt. Step 7. Go to restaurants that will prepare your food with low or no salt. Step 8. Don't eat fast food. Fast food is notoriously high in salt. Did you know? Among the many uses for salt other than in your diet are soothing bee stings, repelling fleas, and cleaning cutting boards.
Sodium is hidden in a lot of different foods. The amount of sodium is very high in restaurant foods, deli meats, and many canned, packaged, frozen, or other processed foods. These include boxed noodles and rice, cakes, muffins, and pancake mixes, canned vegetables and soups, canned meats and fish, salad dressings, seasoning mixes, salted butter, sauces and gravies, snack food, tomato juice, and vegetable juice. People trying to prevent heart failure or people who've already been diagnosed with it should choose low or no sodium foods. And so one thing they need to do is read food labels. Sometimes canned stuff like beans or like soup come in low sodium types, and they should be looking for those labels. Other ways to lower sodium in the diet include eating lean meat, using flavored vinegars in place of processed salad dressing, eating more fruits and vegetables. So fresh fruit and vegetables have really minimal sodium in them. Eating food without sauces, ordering salad dressing on the side at a restaurant so you can really limit the amount you use, avoiding heartburn medicines. A lot of heartburn medicine uses sodium. Reading food labels, you don't want to see sodium as any of the first few items on the list of ingredients because that means there's a lot of it. The food label will also tell you the actual number of milligrams of sodium in the food. Limit salt in cooking, so really add very little salt while cooking and remove the salt shaker from the table altogether. So watch this video about how to have a healthy eating conversation about sodium. And as you watch the video, ask yourself, what do you like about how the two educators are interacting with the patient? And what might you do differently as a community health worker and why? Once you're done, once you click on the video link and watch it, then come back to the PowerPoint.
Hi, I'm Jim.
And I'm Danae. We're on location with the Check It, Change It reality show. And today we're checking in on Doug. Doug's doctor told him he needs to reduce the salt or sodium in his diet. So we're going to pop in on him and see how he's doing with his Check It, Change It goals. Let's go.
Let's go.
Hey, Doug.
Hey, Doug, how are you? You know who we are?
Yeah, you guys are from the Check It, Change It show.
That's right.
That's right. And do you know why we're here, Doug?
Not entirely. You're either wanting to see me do some exercises or you're wanting to see what I'm eating.
You got it. So tell us, what you got here?
I think I've done pretty well. I didn't order anything with fries or a lot. I knew that was going to add a lot of salt. So I did the salad. Salad has to be good for you, right?
Let's take a look at how much sodium is actually in that chicken Caesar salad. Okay? Now, Doug, are you ready for this?
I guess so.
Okay. This actually has 4,100 milligrams of sodium.
Are you kidding me?
Nope. Sodium actually hides in lots of foods, like salad dressing, croutons, those little crispy wonton things. A lot of times meat can have a lot of sodium added to it as well.
Well, 4,100 milligrams is just past my limit.
That's right. This much salt has about 1,500 milligrams of sodium. And that's your daily allowance. And this is the amount that's in your salad. Yeah, not so good. So let's take a look at what you could have ordered. Thank you. This is the salmon with broccoli. It has about 450 milligrams of sodium. This is the lemon chicken with sauteed vegetables. It has about 600 milligrams of sodium. Both a lot better choices than your choice today. At most restaurants, a waiter can help you choose a low-sodium food. You know, Doug, I think you could benefit from a little bit of grocery coaching. Let's say we meet at your house after work.
Are you serious?
Of course.
Okay.
Okay, Doug, the first thing we're going to do is stop adding extra salt to your foods.
Okay, I guess I can take the salt shakers off the table and put it in the pantry. That way that'll help me remember.
Good. And don't add any salt to your cooking either. Just remembering those first 2 tips will help you out a lot.
Okay.
Next, we're going to write down what you eat over the next 2 days, okay? And we're going to start reading the labels too. Let's pull something that you normally have for breakfast.
All right.
We'll start with cereal.
Okay.
Check the sodium and write it down here. Good. Do you notice the heart check mark on the side of the box?
Yes.
It's a good indicator of a low sodium, low fat food. We also need to check portion size as well. This is the amount of sodium in 1 cup. Is that how much you usually eat?
Yeah, but I usually have 2 bowls.
So we need to write them both down then.
I also add fruit. Is that going to add any hidden sodium?
Not likely. You can bet when you go with a fresh fruit or vegetable or even meats like chicken or fish, you'll be pretty okay.
Okay.
Train yourself to shop the fresh food sections instead of the packaged sections, and you should be okay.
But read the labels, Doug. All right? Don't forget. Oh, also, we brought you a gift.
You did?
Yes, we did. We brought you a low-sodium cookbook. This is going to help you put together an eating plan that's going to work for you. Also, it's going to teach you new ways to enjoy food with a lot less sodium. And our viewers can stop by any library and pick up a low-sodium cookbook. Giving it focused attention even for a few days will help you learn new habits that you can practice for several weeks.
Well, okay, Doug, we just got a few things to go over with you as well. But first, we need to sign off with our Check It, Change It reality show. Do you have anything left you want to say to our viewers?
Well, I do know that this is important. It's just going to take me a little bit of practice.
That's the spirit, Doug. Let's get that blood pressure down, man.
Good job.
Stress and your heart. Stress helps you meet the demands of daily life, but too much stress, or stress that lasts a long time, can cause health problems such as high blood pressure, nervousness, depression, or stomach ulcers. What can stress do to my heart? Stress can raise your blood pressure and make your heart beat faster or beat irregularly. Your muscles may get tight, you may feel more alert or jittery, or you may feel more nervous or upset. Physical changes that stress can cause can raise your blood pressure, make your heart beat faster, cause your heart to skip a beat, and cause sleeplessness. Emotional changes stress can make can cause you to be nervous or depressed, can cause you to feel tense and jittery. It can cause you to overeat, smoke, or drink alcohol. It can cause tiredness. When do you need to get help for your stress? If the following feelings last longer than a few weeks, you should talk to your doctor. Not tending to your appearance, cleanliness, diet, or exercise, loss of interest in activities or people, always thinking of or worrying about your condition, having trouble getting to sleep, or sleeping too much, or not sleeping enough, using medicines or alcohol to help you sleep, or having thoughts of hurting yourself or someone else. We're going to be talking about stress in more depth in a later lecture, but for now, some basic suggestions for reducing stress. Try to figure out what causes you to feel stressed. Talking to someone who cares about you often helps. You need to talk about how you feel and what you think. Try to think about your situation in a hopeful way. Avoid blaming yourself and others for your situation. Start by having a hopeful outlook. Avoid activities or situations that cause you stress if possible. Learn how to relax. Start a regular exercise program when approved by your doctor. Learn how to meditate or do yoga. Follow a healthy diet, and build a support group of family and friends. Your healthcare team can help you learn ways to relax, follow a good diet, and start an exercise plan. For people who've already been diagnosed with heart failure, walking is usually the best activity. It's easy, it doesn't cost a thing, it's safe, it's good for you, and it's fun, especially if you walk with a friend. Now, anybody who's already been diagnosed with heart failure has to talk to their healthcare team to make sure they understand what level of walking or other activity is safe for them. But it's actually really important for people with heart failure to remain or become physically active, because heart failure can get worse if all they do is sit on the couch all day. So recommendations in terms of walking: walk anywhere that's easy, close, and safe for you. Plan where you will go before you walk. Think of flat areas where you can walk, such as shopping malls, school tracks, or streets near your home. Pick a time and place that works for you. Plan to walk with someone. If you can't, be sure someone knows when and where you're walking. When should you not walk? Do not walk if you're not feeling well. If, for example, you have a cold or a fever, wait 24 hours after your temperatures return to normal before increasing your activity. Do not walk outdoors if the weather's too hot or too cold. Find an indoor place to walk, such as an air-conditioned shopping mall in the summer when the weather isn't good. Do not walk right after you eat a meal. Your heart is busy pumping needed blood to digest your meal. Wait at least 1 hour after eating before you go walking. If you miss more than 3 days of walking in a row, decrease your time and begin again slowly. This is a plan for life, so don't worry too much about catching up. What should you wear? Wear loose-fitting clothes. If you have comfortable shoes that fit well, wear them. Well-cushioned shoes such as Oxfords or sneakers work well. Wear socks to give a little more cushion and help prevent blisters. What else do you need to know? Your doctor or cardiac rehab staff will tell you if you need special instructions, such as how to check your heart rate or other information that will help you to be more active. Smoking and secondhand smoke are significant risk factors for heart failure. If you smoke or are around a lot of secondhand smoke from other people smoking, the smoke can affect your heart and your blood vessels. The nicotine in cigarette smoke causes your heart to beat faster and raises your blood pressure. Tobacco smoke damages blood vessels, and this damage adds to plaque buildup in blood vessels, making them become smaller. At the same time, nicotine causes blood vessels in your whole body to contract, so they're smaller still. When your heart muscle is weak from heart failure, cigarette smoke makes your heart work too hard, and it can't work properly. A weak heart pumps less blood than a normal heart, so less oxygen reaches the brain and other organs. Smoking lowers the amount of oxygen even more. This lack of oxygen may cause dizziness, lightheadedness, or tiredness. It is really hard to quit smoking. It's an addiction. Most smokers know that they should quit. Many smokers have tried to quit before, but it is just very difficult to quit. And there's some ways that community health workers can support people who are trying to quit smoking. There are actually more former smokers than current smokers, but many people still die from the habit. Each year, about 70% of smokers report wanting to quit, and more than 40% try to quit. Let your client know you're concerned about their health and remind them that you'll support them when they're ready to quit. Ask how they'd like you to help and wait for them to reach out to you. Don't nag or offer unsolicited advice. Sometimes the client isn't ready to quit smoking just yet, even if they have expressed interest. Let them know that you care about their health and want to offer support, but give them the freedom to decide when the time is right. Put health into perspective. About 40 million U.S. adults still smoke, and cigarettes remain the largest preventable cause of premature death and disease. In fact, smoking is linked to nearly 1 in 3 cancer deaths in the U.S. While many smokers already know the risks of the habit, others may not realize the damage they're doing to themselves and their loved ones. The most important step a smoker can take is to stop smoking. The health benefits of quitting are profound. Kicking the habit lowers a smoker's risk of lung cancer, heart and lung disease, stroke, peripheral vascular disease, and respiratory symptoms like coughing, wheezing, and shortness of breath, as well as reducing infertility for women of childbearing age. Help your client understand just how much they risk by smoking and just how much they stand to gain when they quit. Offer encouragement. Quitting is a day-by-day process that varies for each smoker. When trying to help someone quit smoking, it's important to stay supportive and positive by providing encouragement, especially on challenging days. Express how proud you are of their willingness to quit and the accomplishments they've made toward quitting so far. Offer to check in on them via calls or visits to ask how they're feeling and remind them of their progress. Create a quit kit that includes gum, toothpicks, or mints to help them when they have the urge to use tobacco. Your continued understanding and support will help them keep trying and succeed. Understand the addiction. Addictions caused from smoking are both physical and emotional. 80 to 90% of smokers are addicted to nicotine. In fact, smoking may be equally as addictive as cocaine and heroin and can be just as challenging to quit. It's especially important to be patient with your client during the initial withdrawal period. The most common symptoms of nicotine withdrawal include anger, anxiety, difficulty concentrating, irritability, restlessness, difficulty sleeping, weight gain, and increased appetite. Remind your soon-to-be ex-smoker that these symptoms are normal. They may be unpleasant and intense at first, but they go away with time. Slip-ups can happen. For most people, the urge to smoke will subside after about a week, but slip-ups can still happen for weeks or months after kicking the habit. If your client slips back into smoking temporarily, continue encouraging them to quit rather than criticizing this slip-up. Above all, stay positive. It takes smokers an average of 7 times trying to quit before they are successful in quitting forever. So having a slip-up doesn't mean that they've failed. It just means that they are on to their next attempt to quit. Seek outside help. When you're learning how to help someone quit smoking, keep in mind that some smokers may require multiple attempts. If your client is having difficulty or suffering from severe withdrawal symptoms, help find them a physician, behavioral therapist, or group therapy. Many people find giving up smoking challenging, but with the right information and support, they can and will succeed. Many health insurance will cover smoking cessation programs that offer support and counseling, and in some cases, nicotine replacements such as gum or nicotine patches. And you can help link your client with these type of services. Now you can describe strategies for preventing heart failure. Mini Module 3C is next, diagnosing and treatment of heart failure.